Hello, welcome back. Can inguinal hernia occur in children and babies? Definitely it can happen. Like any other adult, inguinal hernia is very common in children also, most of the time at by birth. So these are all called congenital hernias. That is means it's a birth defect kind of thing. And the how it presents, usually the mother or the caregivers are the one first will notice. Usually when the baby cries or when it strains for the motion, when it strains for the urine, they can see a lump or swelling in the groin area or the inguinal region, and usually it will disappear and will come back. And it sometimes, most of the time, very rarely it can not reducible, it can remain the same. So that's called irreducible hernia. So inguinal hernia or groin hernia can happen in male children, it's very common, and even can happen in female children. So in the previous videos, we have talked about the umbilical hernia. See, the umbilical hernia, usually what we say is you can wait and watch for some time, because it can usually can close it on its own. Generally, we say if it not closing on its own, probably before going to school, it has to be repaired. But in inguinal hernia, it has to be repaired irrespective of the age. Either it's 6 weeks old child, 6 months old child, 6 years old child, it needs to be repaired, because the complication rate is very high in inguinal hernia, and especially in boys. So irrespective of the age, hernia needs to be surgically treated. The only option, of course, surgery. But the difference between adult hernia and the children hernia is, here we don't keep mesh at all. We do only herniotomy. In adult, it's called herniorrhaphy with a mesh. Here it's only herniotomy, just stitches. Most of the time, it's done as a daycare procedure. Even it's a breastfeeding child, it's done as a daycare surgery, and you don't have to stay in the hospital. Very rarely we keep them for a night. And most of the parents will be worried about whether it will affect their future, their fertility, or all these things. You don't have to worry, because that's got nothing to do with the hernia part, and the children will grow very normally and they will have a very normal life. Thank you.